Welcome back. So, I'm your friend, Solution. So, we were able to talk about what is responsible for body odor, where we talked about improper hygiene of your undies or your body. We talk about hormones, menstruation, menopause, um, various medical conditions, illicit drugs or illegal drugs, some medication, some medical conditions like diabetes, kidney disease, liver disease, and it can be as a sort of autoimmune disease where the body tissue begin to attack itself. It can be as a result of not cleaning up or not bathing, as it were, properly. So, and we talked about bacteria or vaginal infection, or if a man is uncircumcised, you understand, it can cause all those. Now, let's go straight and to talk about what we call the remedies for body odor. Talking about body odors, you might, to combat it, you might have to do one or more of these above things that we'll be, saying shortly. Or you might have to do just one and it will work for you. You might need to combine one or two before it works. But I want you to know, if you have any condition that you are nursing, any health condition prior to this body odor, it is advisable first to see your physician to let them know these are what and what you intend to use as part of home remedies to curb or prevent what we call body odor. You understand? And number one thing you want to do is proper hygiene. When we're talking about proper hygiene, it starts from how you can brush your mouth. It starts from how you can clean your armpit very well. It entails showering at least once a day or bathing once a day, minimum of once a day. It entails, as a woman, you wash your bra. It entails, as a woman, your panties should not be worn more than once a day. It entails that a man, your singlet, your boxers, your panties should be adequately washed, not using your panties or your boxers or your bra or your tights or your pants for 1 week, 3 days, and you are just wearing them. Even your gym wears. At times when you go gymming, there will be a lot of sweat because those are rigorous activities, and your body, the muscles are contracting and relaxing. So there will be giving up of sweat. So when there is giving up of sweat, you must make sure that those gym dresses, before you wear them the next day, you have to wash them. So you can have more than one if it is possible. So that it is not when you get outside meeting with people and they start using style to run away from you. You are like that. They are trying to, reverse a little before they could talk to you. It's so embarrassing. So what you want to do is make sure your hygiene is on the top notch. You want to brush not once; it has to be twice. That's the personal hygiene is the first thing. Is the very very first thing. When you leave personal hygiene, your environmental hygiene is so important. If you don't want to be smelling out there, especially your room where you live, your beddings, is it that you have left those bed sheets there for like 3 4 weeks up, and you are sleeping, you are sweating on those ones and you cannot still wash them. Your socks, your shoes are part of your personal hygiene too. Your shoes should be well aerated because both male and female, we have these tendencies of having smelly feet, not because you are dirty most of the times, but because that your shoe and with your socks is already making your shoe, your feet to be enclosed. And when your feet is enclosed, you might not be able to get fresh air. Maybe you work 8 to 5 or something, or you are a business person, you've gone since morning, you're coming back. It means maybe probably between 8 hours, 10 hours, your shoes has been on. And when your shoes are on for 10 hours, 12 hours, and you get home and you cannot irate them, just drop them, put the socks right in. Some of us will stock the socks right inside and you leave it there. And what happens the following morning, you're picking it up. It's going to smell to people when you get out there. So your hygiene has to be top notch if you want to fight what we call body odor. So to help yourself, if you know you cannot maintain the hairs on your armpit, it is advisable that you get a shaver and get it cut it off, cut everything and make the place, you feel free, you feel neat, even when they are not there. But if you want to keep it, it's all your, because some people are natural, they want to remain natural, leave everything, leave the air, everything. You can leave it, but it has to be properly cared for. Not that you raise your armpit or you get to people and they're trying to run away from you because of the smell. So, of course, you can invest heavily in antiperspirant. There is a particular antiperspirant that doctor recommend that has aluminum chloride. It does wonders against body odors. Does wonders against body odor. You can use deodorant, you understand. Aspirant will not make any sweat at all come. It will work against, sweating, while deodorant will allow you to sweat so that all the dirt that are supposed to come out via the sweat under your armpit will still come, but you won't be smelling to people around you. If you are going through body odor, you should be able to wear breathable clothes. It's not the time to wear clothes that cannot make air penetrate inside your body. You're wearing heavy clothes. No, you have to work it out. The kind of dresses you want to use, not just wearing, clothing because you want to wear clothing. It has to be the type that can breathe, that can allow fresh air to penetrate through that dress into your body directly, to prevent excessive sweating, to prevent excessive moisture collection under your skin, and you begin to smell. And for the women, you want to bath, there are proper places for both men and women anyway. There are places that has to be, like taken into consideration that, okay, I'm going out, I don't want to spend, where are the places I want to take cognizance of? Within your nursery. Your nursery has to be cleaned properly. Your mouth has to be clean if you don't want to smell outside. Your ears within, and of course at the back of your ear right there, is full of oil, sebum, and there's not much fresh air going under, behind your ears, and it makes someone to smell. And of course, your armpit, you have to take care. Your groins, just between your two laps, those areas don't have enough fresh air, so they are exposed to moisture. And when moisture is in a place, bacteria tends to enjoy the place and thrive. And of course, in between your two butts, buttocks, the right and left, there's a thin line between those two that goes in straight into your anus. It has to be properly washed. It has to be properly washed. And most of the time, it is advisable that if you poo, it is better to use water to clean. You understand? That is the best. Because if you don't use water, or you are using wipes, if you can use wipes, fine, because wipe is it has like liquid. But if you are using tissue paper, the there is possibility that you are not cleaning what you are supposed to clean. So most of the time, it's like you're just doing wish wash. It will not get down. So all the sebum, like the oil, the body oil, and the bacteria that are around that anus area, the inner canal. So those areas are where you should take, into consideration when you are doing your personal hygiene in the morning. Then, of course, you got to watch your diet. Your diet is very, very important here. Your diet is very important. Like if you are the type that eats cauliflower, you have to, reduce it. If you eat too much of broccoli, it has to be reduced. Too much of cabbage, too much of garlic stuff, it has to be reduced. You understand? Because there are some of the things that can predispose you to body odors. And what about alcohol? Maybe you must have heard some people say, oh, it's reeking of alcohol. She's reeking of alcohol. It means that when you drink alcohol, you smell, especially when it's becoming excessive or you're getting addicted to a point of no return. You can drink anything. You understand? So you should, know what you drink, your alcohol. You should be able to reduce or limit your alcoholic intake. That's just what we are trying to say. And it still boils down to what you take into your mouth. If you are the type that like garlic, okay, you can still get garlic, grinding it and mixing it with your stew or your soup. But when you are the type that eats garlic raw, you understand? It smells. It smells. Like me, I can't even stand the odor of your garlic. And of course, there's something you got to do again is staying hydrated. When we're talking about staying hydrated, you need water and plenty of it. Water, water. It has no substitute. Your sugary drink, your juice, your smoothie cannot take the place of your water. In fact, before the classification of food, we had the fat and oil, we had the protein, we had the carbohydrate, we have the minerals and vitamins or something. But now they added water as a classification of food. So you know that is that important. So you want to stay hydrated to prevent body odor. Our body is like 75% of water. Your mouth needs water. Your eye to make its tears needs water. Your skin needs water. Your intestine, small intestine, large intestine, your stomach, when the food comes, is going through the esophagus straight to your stomach. Stomach needs water so that the hydrochloric acid right there that will digest the first place of digest, the third place of digestion from here down there needs water, is going to, do the digestion will not be completed. It will digest its own. That's the stomach. Takes it to the small intestine. The small intestine needs water to make it soft. As it's taking it, it's going to give it to the liver. The liver needs water to be able to do complete metabolism and distribution. You go to the kidney, you go and for storage, you go like this. It needs water, and when it gets to the kidney needs water to flush out the toxins of what you have eaten, either alcohol, either drug, either medications, or something that you've eaten. Your liver needs water. When liver needs, the kidney needs water. As the kidney is, distributing, say, okay, I don't need this. These are waste products, and it's pushing it out with water. It needs water, and it's still going to the large intestine. The large intestine needs water to be able to process. You understand? And push the remaining. The large intestine will still store its own and push the remaining to your anus before you can poo the rectum, then the anus, like that. Then you will see that we need water. If I'm not hydrated the way I'm talking, you will see my either this place, you will see some whitey substance like saliva. They'll be all over here because my mouth is dry. My mouth will be dry. You see my tongue that is red. It will be coated like with white. It will be whitish. It will have whitish substance on top of that. So we need water, water, water. Nobody can do without that. You can't do. You can do without food, but you can't do without water. And of course, you can use rock salt. When we're talking about rock salt, it's something that you can mix with the water, you understand, and bath with it. It takes away a lot of body odor from somebody. And of course, you can use an antibacterial soap. You understand? There are soap that are just they are medicated. That's the antibiotic soap or antibacterial soap. Then we have soap that are just normal. They don't have, they're just for bath. They don't have any bacteria. So if you know you are going through that, because we've said it that bacteria and sweat, when they combine together, they form serious body odor. So what do you want to do? You want to combat it or remedy it. What do? You use antibacterial soap. So when you use it, helps the system. And of course, tomato juice is very, very important. If you can tolerate it, you can make your paste, you can make your tomato juice and drink. When you drink tomato paste and tomato juice, it assists in lowering your body temperature. And of course, it helps. Tomato juice also, apart from body temperature, it also helps to reduce excessive sweating. So with these two combination, lowering the temperature and of course reducing hyperhidrosis, that is excessive sweating, you are good to go. You are good to go. And some even use it like a paste. You make it like a paste or just slice it the way we slice our cucumber, just like that, and use it to rub. You use to rub before you wash it off, right? Then, of course, when you after bathing, you should dry your body thoroughly. Dry it thoroughly. Don't leave no water in your body. You understand? Make sure you dry your body thoroughly. And if you have body hair, like some people in the nose, if your nose is the type that smells, or you have ear underneath your armpit, and you notice that when you wear your dress, there is stain like red, or there are stains like um, brown or yellow underneath your by your clothes, especially when you are wearing white and it's noticeable. It is better to trim all those off. It's better you shave. We have a lot of things. You can use the manual one, you can use the electronic one. There are plenty all over there and very cheap that you can use to, and you can use your cream. You understand? Hair remover, you can use it. Just 1 minute is off. 1 minute is off. You can use it. So you have to make sure you manage your ears, especially under the armpit, if you notice that you are smelling. Of course, you have to try. There's something we call essential oils. Essential oils can be rubbed on the body. And of course, because most of these essential oils that we have, they have antimicrobial properties. That is antibacterial. Microbes are bacteria. Antimicrobial properties. You understand? And of course, you can use baking soda. You can use baking soda like a paste. You understand? Baking soda, they use it for bake. You just take it. It will not be too watery. You make it as a paste. Then you can put it underneath your armpit. You can put it at the web of your foot. You understand? Put and close up. Put and close up. Put and close up. Just like that. And when you put to the two arms, leave them to stay like 15 minutes before you wash it away. You understand? It has to be a conscious effort. You want to stop smelling so that people start running away from you. It has to be, you know, as in conscious effort. It's not the time to, because if you know how people treat people that smells, even with mouth odor or body odor, you know that it's crazy. Some people are toxic themselves, and when you give them just an inch to talk to you or to troll and drag you, they are ready to drag you more than 100 miles. So you have to do your own bit and your own part. You understand? Which are just the home remedies, personal effort, and if all phase will be, talking about that. And you can also add your baking soda to your bathing water. Just add it there, leave it for some time, let it properly mix up. You bath with it and make sure you dry your body very, very well. And what about your clothes? Your clothing has to, be properly cleaned. Don't wear, if you are the type that sweats. Even me, I find it difficult to wear a dress, as in go outside this house and still wear it tomorrow, wear it next tomorrow. Even my uniform in my place of work, I have about five. It's even not about, I have five, and I have two ceremonial, making seven that I have. So if it's the day that we are wearing the ceremonial, which is our white uniform, I wear this week, they dry clean it for me. Next week I'll pick, because we wear that one once a week. Then the scrub, I do night duty 5 to 8 a.m. Of course, the guy washing will come and pick. And if I don't want to, I will just bring it to the house for my children to launder for me. So when it's not that I'm not getting to the patient, and the patient is trying to, avoid me, stylishly. No, it doesn't speak well. So your dresses has to be clean. Either you sweat too much, or you are not the type that sweat too much, or you don't even sweat at all. If you wear one dress, as in for 2 days, it's okay. The third day, even in overseas country, they say there is no dust, there is no this and that, but they see sweat. So if somebody is sweating, you still have to remove it. You have contact with people, a lot of, you are bringing bacteria home, back to your own children, to your own family, right? Then, of course, coconut oil is something that I've seen people try, my own clients, and it has worked wonders. Your coconut oil, especially if you are tolerating it, because some people don't like the smell too. If you are the type that tolerates it, doesn't irritate you, you can place it in your armpit, on your toe. You can still use it to rub your body, and it has been working wonders. And there's something we call hydrogen peroxide. Hydrogen peroxide too can be used. You can use it. You can mix it together with that baking soda. If you just take like 1 or 2 teaspoonful of baking soda, then 1 or 2 teaspoonful of your hydrogen peroxide. When you mix, there's something we call effervescence reaction. It will be bubbling like that. When it bubbles, what do you want to do? Mix it together properly. You can make it as a paste. You can use it on your toes. That's in between your toes, the fingers of your toe, the web. You mix it, or if you don't use it like, you can place it in your bathing water too, to make it easy for you to go. And if you have what we call hyperhidrosis, you are inside AC, you are sweating. Not that you are going through, for women going through menopause or menopausal syndrome or postmenopausal syndrome, we used to have excessive sweating. That is hyperhidrosis. That is for women. But now, as a man, you are now having hyperhidrosis. Even as a woman, it is advisable for you to see your doctor. So if you're able to see your doctor, the best for you. If you're going through hyperhidrosis. And of course, you can rub lemon juice on your armpit. You can rub lemon juice on your armpit, leave it for some time before you wash it away. Then, of course, apple cider vinegar and baking soda can be added together to make it as a paste. You can rub, and of course, what do you want to do? You wash it up maybe about 15 minutes or thereabout. And of course, that apple vinegar on its own, you can also use it to clean. You can put it in your water. Some advice that if you have serious body odor, you can be drinking a little, once in a while. And of course, you have to stay hydrated. You need plenty and plenty and plenty of water. You need plenty of water if you know you want to overcome issues with what is it called now? With body odor. Rub your lemon on your armpit. Make sure that you had baking soda or lemon inside your bathing water. It makes it so easy and easy. Use antibacterial soap. It is very important. It will seriously help you. Antibacterial soap will seriously help you out, because it will reduce and the multiplication of bacteria in your body. Watch your diet. If you are the type that eats more broccoli, plenty of cabbage, plenty of cauliflower or garlic, it's something that you have to review and think, oh, is this really worth it? Is this what I really want to do? You have to watch them, reduce them. Maybe you eat them all through the week. You can reduce them, like play small, so 3 times or 2 times. Wear breathable clothes, clothes that can allow fresh air to enter into your body. You can use antiperspirant that will prevent excessive sweating, and use deodorant that will make the place to be dry and you feel fresh. You understand? Your socks, your personal hygiene is very, very important. Make sure that your socks is not, you wash your socks. If it is possible, you can have 7 pairs of socks. And when you wear one pair on Monday, you wash. When you wear two, the second one on Tuesday, you wash. By the time you are able to wash them 7 days of the week, next week you are good to go. You start changing them on again. Not that you now wear one socks, the same socks on Monday, and you still wearing on Tuesday, Wednesday, Thursday, Friday. Oh my God, the whole place is going to blow up with smells. You understand? Because of the smells in our body. And if you have outlet food, make sure you can see your pharmacist if there are things they can give you uh, over the counter, or you can go to pharmacy, or you can see your doctor if you have outlet food or any fungal infection that you don't understand. If you have vaginal infection or any yeast or fungal infection, it is advisable to see your doctor, because there's a lot of things on internet that you start seeing. Somebody say you have this, go and do this. They don't know your health history, your health status, and it is not all these things that works. It's not all of them. So don't just jump into internet and be googling your symptoms. It is advisable, if you have any fungal infection that refuses to go, like the outlet food, it has been there. You have vaginal infection that has been there. You have to, take care. If you are not circumcised male and there's smegma, there's something we call prepuce, that the skin, the foreskin on top of your penis, that is not circumcised. At times it gathers bacteria, gathers moisture, gathers oil. There's no fresh air going there, and there will be accumulation of smegma. You understand? Whitish substance like that, and it will make your penis smell. If it is like that and you are not feeling comfortable, it is advisable you go to the hospital to see your doctor. If there's something they could do to you, or further evaluation, they assess you, evaluate you, and be able to, since you don't want to, maybe your culture they don't circumcise, or your family they don't circumcise, you have to see your doctor. If it's becoming an issue and you are smelling and people are running away from you, then if you have various underlying medical condition like diabetes, or you don't even know, some don't know that they have diabetes, but you start perceiving odors like sweet smell. You understand? It is time to see your doctor. It might be as a sort of excessive breakdown, because something ketones in your body that are making you to smell like that. You have kidney disease. You must start having odor like urea. There will be uremia. That's uremia, means there is urea. It's one of the end product of kidney, and it's not supposed to be inside the blood, like there's somebody that will be seeing it. When there is problem with the kidney, when we do investigation, it's one of the things we see. They say, oh, the urea is excess. That is, this kidney is almost going. So that's the reason when you are seeing some, things, you're perceiving some odors, and it has not been like that. You have to see your doctor. It might be a kidney disease. It might be a liver disease. If it's liver disease, it can be fishy in nature. The odor can look like a fishy odor. You understand? If it is liver, something like that. If it is kidney, like acid, like uremia. If it is diabetes, it will look like sweet. The scent, the odor you'll be perceiving. Those things you have to see your doctor. If it is rheumatoid, if it's an autoimmune disorder, autoimmune disorder, you have to see your doctor, because autoimmune disorder, I mean that the tissue of a particular place in your body, they are fighting against that particular place. And what do you want to do? It's not something you can do yourself. So you must go to the doctor, let them know what kind of autoimmune disease is it. Is it gout arthritis? Is it rheumatoid arthritis? Is it lupus? And lupus is crazy too. You understand? And if if you are going through cancer, you are going through cancer therapy, and you find out that there are some odors around you, it's not the time to joke around. No, don't fool around. Just go straight to the hospital. Let them reassess you. so that they'll be able to know, okay, why are you smelling? What is smelling? They want to know the source of that odor. You understand? So that there will be proper assessment, evaluation, and of course management. But if not, somebody can just somebody can just die. So it's not the time to just be going to Google, going to ChatGPT, going to Meta AI and say, tell me, why am I smelling? Why? No, it doesn't have to be like that. And if you're going through excessive sweating and it has not been like that, that should tell you, except for women. Women, when we are entering menopause or when we are in menopause or after menopause, we have excessive sweating. It's part of the symptom. You understand? Premenopausal symptom is part of that. It can be before, it can be during menopause, it can be after menopause. So if you're feeling like that, you should go to the hospital and for a checkup. If it's not controllable, if you are pregnant and you are perceiving some odors and you don't know what it is good to go and see your gynecologist, your ORG, so that they'll be able to check you and see, okay, is it the baby? Is it something? Most of you see pregnant women most of the time, you are cooking in their side, they are irritated by that smell, something that they like. They cannot even stand the odor right now. You understand? And if you have any groin, uh, your groin, there is smelling, and that place is smelling, you have to wash your groin. Your groin is part of where to wash very, very well. Your between your two anus, this is your um, butt to the right, your buttocks to the left, and there's that tiny place that leads to your anus. Is where in fact, you can wash like me. I can wash that place up to 4 times a day, more than, because I know it collects moistures, and our digestive system, especially the large intestine, has a lot of bacteria with which it works with to help us digest our food and protect our intestine. You understand? So, and most of them might just come, you know, that to that inner part that we used to clean. So why won't I clean? So those are the areas we should take proper care when we are washing your mouth, your nose, behind your ears, within the ear canal. Your armpit is very important, your inner part, your groin, just before your thigh, the two thighs, after your male reproductive part, that place has to be properly cleaned. So, and if you have done all this, you have gone through all this, you have used your tomato juice, this, you have dried thoroughly, you wash your diet, your deodorant is in place, your antiperspirant is in place, and a lot of things, and you're still feeling the smell, it might be the time to go see your doctor for proper assessment. They'll be able to check you from head to toe what is wrong, to be able to, arrive at a conclusion and be able to treat you appropriately. Appropriately. It is better to see your doctor. And there's something finally that we call rose water. Rose water too has been used, and people that used it, they came down fine. You can use rose water to put it under your armpits, all those areas that smells, leave them like few minutes before you rinse up. Of course, you can use your rose water to bath, and if all effort fail, it is advisable you get to see your doctor. Breathable clothes are so important. So make sure you take care of yourself. Health is well, and see you in the next video. Bye bye for now.